chitab Kalenjin ako itagat en tetutyetab Health Watch. En wikini konye ko kokiker kaimutikab sikisiet ak en wikini kekere kamanutietab IVF en sikisiet. Kotomo keker IVF konyolu kenai akobo IUI en sikisiet.
The process of IUI is very important, especially for male infertility, where our aim, it has two conditions, where we have a low sperm count or a count that is not optimal, maybe even the speed is not optimal, or in some cases where we have some diseases that we do not want direct contact, diseases that can be where the infection can be passed between the couple, because in some cases we also have discordant couples, so we want to avoid direct contact, okay? And the third indication is where we are doing sperm donation, okay? And you're using frozen sperm to actually treat the infertility caused by the male partner. So the first thing that happens in IUI, the male partner gives the semen in usually a sterile special container that is not toxic to the sperm. And this sperm then undergoes processing, usually by washing with substances that activate the sperm, and then that concentrate the sperm so that the sperm is concentrated in almost a few drops of 0.5 ml. Okay? Then that is taken up in a syringe, and we use a special catheter to put the sperm inside the uterus. As you can see, it has been deposited quite close. So the sperm doesn't have to do the work of moving all the way from outside, traversing the cervix, traversing a lot of the uterus. If you have a very small quantity, then very little will get to the tubes. But if you concentrate it and put it near the tubes, then a lot more can get to the tubes, facilitating fertilization. But usually we need for the tubes to be open. So IUI is not for everyone. So if the female partner has tubal blockage, then you cannot use IUI. You cannot use intrauterine insemination. So if such a patient has blocked tubes, or the sperm quantity is very little, like we are finding 100,000, that cannot be used for IUI. In that case, we have to go for IVF. So the process of IVF is different, because with IVF, we start stimulating on the second day of the cycle, okay, when the menses come, and we give medication to allow growth of many eggs, okay? So that this is a single egg inside the ovary. We want them to be very many inside the ovary. And once they have matured, usually that takes 10 to 12 days of injections. Once they have matured, there's an injection we give to cause separation of the egg. And before it completely ovulates, we go in using a very small procedure. While the patient is not feeling pain, we are able to suck out the eggs and put them in a tube. Then this tube is taken to the lab. Okay, this fluid is taken to the lab, and a specialist called an embryologist will then manipulate, clean the eggs, a process we call screening, okay? And then washed and prepared sperm is then put with the egg to allow fertilization in a process we call in vitro fertilization. Or if the sperm count is very little, then the egg can be injected with a single sperm. And that allows for fertilization to start taking place, and there will be division, and the fertilized egg will then start undergoing the process of cell division. And either we can transfer this embryo back to the uterus on the third day, okay, or on the fifth day when we call it a blastocyst. So the process of transfer is like that of IUI. We put the embryo in a very soft catheter, a very small soft catheter that is favorable to the embryos. They are put within the tube, and then we deposit them inside the uterus so that we just drop them here. And from then on, usually the embryo is at that stage of cells. We don't put babies, we put cells, okay? Then, with time, and if all works out well, and we have favor, God, then these embryos will then start growing, they will divide further, and then a fetus will be formed inside the uterus. So people say we are transferring babies. No, usually our work ends at putting the dividing cells inside the uterus, okay? And then after 2 weeks, we are able to do a blood pregnancy test and tell whether this patient actually has conceived or not. Then after another 2 weeks, we are able to check using a scan to see whether the cells have continued to grow, and now we can see a sac having the baby. So IVF is as simple as that.
Process noton po IVF konome en betut netai en betusiekab arawet en kwondo.
So we always start the cycles at the beginning of the month, okay, when the woman, not of the month of calendar month, but when the woman has her menses starting, okay? So if her periods begin today, then we want to start the following day or the day after. And then we have a period of about 14 days until we peak 14. But for people with longer cycles, it can be longer, but on average about 12 to 14 days. Then we pick the eggs. Then the eggs go to now the embryologist, and then there's the IVF lab, where quite some conditions and complex procedures are done. So there's then fertilization, and then the egg is kept there up to a maximum of 5 days. So we can transfer on the 6th day. So if you add, say we are taking 14 days, then you transfer on the 6th day, that is about day 20. For some people, you can go up to day 21. And then that's it. Then the lady goes home, she can do her normal chores, as long as they're not very strenuous. And then after 2 weeks, then we do the pregnancy test. So we don't keep you in hospital. You come every day for an injection. Some people take away the injections. You don't sleep in hospital even on the day of pickup. It's a 10 to 20 minute procedure. We get the eggs out. We then fertilize them. Then you go back home and wait for the report of how many embryos you have and whether they are good for transfer or not. And then we call you for the day on the day of transfer, and then you go back home. So I would say if someone needs to do IVF, they should block off about 21, 22 days. Yes, and that's enough. That's 3 weeks. Okay, but you're not with us every day, but at least if you're needed, then you don't have to keep on asking for permission from work. Or if you're traveling, so you're traveling from a place, then you need to go, maybe you're in the countryside and you need to go to a town, then you need maybe to look for accommodation for those days.
En kasarata tugul konyolu koribgei kwondo ak kwam amitwogik chenyolunot.
Remember, this is an embryo growing within you, so you should behave like a pregnant woman. We don't encourage you to take drugs that could be toxic. So if you find you have an infection, don't go over the counter and just buy drugs. You should eat nutritious, balanced diets. There are no particular diets that have been proven. There are many theories out there about what you can eat to improve implantation, but all those are theories. But just a balanced diet is good enough. And then, of course, you should not take alcohol or smoke.
Kaimutikab sikisiet koibu psychological problems. Kit nekamwa Jane Machira kole nyolu kekochi bichoton counseling.
Infertility on its own, first, even before we start the treatment, is a very psychologically demanding problem. Remember, these are people who didn't know they have a problem, because when you're walking, when you get married and you meet Mrs. X and Mr. Y meet, none of them can guess that they have a problem, because fertility, like cooking, the proof is in there, of the pudding is in the eating. Here the proof is in getting pregnant. So people are trying for years on end, they're not getting pregnant, and they can't tell who has a problem. Then they go to the hospital and they're told, oh, you have this problem, oh, you have this problem. And then a lot of psychological issues come up, people start blaming one another. Then the need for a child, society is very demanding. You meet your in-laws, you meet your family members, workmates, why don't you have a child? And they can't understand that you're trying but not able to. So that puts a lot of pressure on the couples, and a lot of this burden goes to the women. I'm sure you know that. The society blames the woman for not having a baby. Then comes the treatment. A lot of fertility treatment is not covered by any provider, health provider, not by any insurance provider, and even NHIF only covers for fertility treatment for those who are civil servants or who have the special covers. So it is very expensive for most of the couples. So a lot of money strain, and then compounded by the fact that a lot of people go to providers who are not able to give solutions, and by the time they are able to get a definite solution, they have spent a lot of money. They spent 10 plus years taking this medicine, going to herbalists, doing all sorts of things and not getting the definitive treatment. So my advice would be that, especially when people have been trying, even your first point of contact should be someone who understands the fertility treatment. And even specialists, even doctors and medical personnel should be willing to refer people to fertility specialists instead of keeping them there taking supplements and taking tablets, ovulation tablets, because some have other problems that they don't understand, that they might not be able to sort out. And then the IVF process is also very involving, because immediately you start the injections, at the end of the 4 weeks, you know, especially after spending quite a bit of money, you're already starting to plan for this baby that you're going to have. And a lot of doubts come in, whatever I'm not successful. Then the injections, the hormones themselves also cause a lot of emotional burden, because the women are affected also by hormones. So at the end of the waiting period for the pregnancy test, a lot of people are already psychologically burdened. So we offer a lot of counseling for people who are undergoing the processes, and it's not enough. They need a lot of support. Okay, fertility to me is a medical condition like any other. It's like diabetes, it's like kidney disease, and people need to be supported emotionally, they need to be supported financially, and no blame should come to anyone.
Kora, kikomuki bichuton teknolojia kokonor gametes chechwak agoi kenyisiek cheite 10.
One thing that has revolutionized IVF treatment is the ability to store or to freeze gametes. Because remember, a lot of these processes produce a lot of extra gametes. Like you saw the diagram was showing you of the number of eggs we are likely to have, especially for young patients or people with polycystic ovarian disease. You could find someone having 30 eggs, 20 eggs. And remember, at a time we're hoping for 1 or 2 babies maximum. We don't want very many babies. We don't want triplets, we don't want quadruplets, because that is a very difficult pregnancy as well. So in the last, say, freezing has been done for many years. Since the initial freezing was for sperm. Freezing of embryos has been around since maybe the 1970s when we started doing IVF. But what we used to do was something called slow freezing. Now, in the last 10-15 years, there has been what we call vitrification, which is a super fast way of freezing the embryos and tends to keep them in the same state. And it's a very good method. So you can freeze either eggs, you can freeze sperms. Sperms are very easy to freeze. You can freeze eggs, you can freeze embryos, okay? And embryo freezing is very important because as a woman, if you get 10 embryos and you transfer 1 or 2 and you get pregnant, the next time you're doing IVF, you do not want to go through the same process again. So we'll go to the cryobank, be able to throw them. It's a very complex process to put them back in the same way, and then you're able to transfer and get children. So we've had people who have had babies from these frozen eggs. And there's a lot of controversy. We fear a lot of things in medicine, and people think, oh, there'll be abnormal. Usually there's no abnormality. The other very useful thing about egg freezing is in the realm of cancer treatment. Remember, a lot of cancer treatment has improved and people are surviving a lot, but cancer medication is very damaging to the ovaries and any other body, and even for men, damaging to the testicles. So if this young person is able to be stimulated and they can store the gametes before the treatment, then after they recover, they're able to use the same either eggs or sperm to be able to get their own biological children. Okay? So the other thing is sperm banks. If you're going to donate sperm, or if people are going to get from sperm banks, remember when sperm is produced, we quarantine it for about 6 months and then keep on testing the donor so that by the time we are transferring, we are sure that there can be no medical condition or infectious condition that we are passing to this couple. So sperm freezing is also very important for that particular reason. Another very interesting reason why a lot of sperm freezing is done is diaspora husbands. So there are a lot of couples where people are in different countries. So maybe the wife is here and the husband is working far off, and comes once or twice a year and they're having fertility issues. So you want to be able to store sperm so that they are able to to attempt fertility even when the man is not geographically present. So it's a very important part of fertility treatment. Freezing the gametes, the sperm or the eggs or the embryos, you can even freeze 10, 20 years, 100 years, but ethically we want to freeze for about 10 years to avoid transgenerational children.
Angot kounoton, kokakimit Dr. Jane Machira kole nyolu eng bichuton koker kanyoik chenootin ko gynecologists asikosich toretet nemagat kosubkei ak sikisiet.
There are quite a number of IVF centers. I work with a number of IVF centers, so it's good to visit either the IVF centers which are available online, or you visit a fertility specialist. Okay, so there are quite a number of fertility specialists in the country. So someone can see me, they can see another fertility specialist to be able to because there's a lot of workup before you do IVF. Okay, we need to know the sperm, how is your ovulation. So you just don't walk in and the treatment is started. You need a bit of workup and investigations to be done.
Ates nedet kole akot nganda toreti IVF eng sikisiet komi tetutik cheimuche kotir borotetab IVF.
We advise and we counsel people a lot about the possibilities of failure. Remember, a lot of failure has to do with the client themselves. Younger patients who have better eggs and higher number of eggs tend to be more successful than if for people at the extreme of the reproductive life. Say if you are 40 and above, you might get one poor quality egg. So you see it has, and usually you sign that you know that it's not 100%. So usually there's no legal issue there in terms of success and whatever, because anyone who wants a guarantee of 100% cannot be offered the treatment. Yeah, there's no one, it's a scientific process. There are many other things that we cannot control. Because remember, according to me, these babies come from God. We doctors cannot give you a baby. Okay? So we will do the process. We will do our best. We'll put the embryos there. How they implant and why they don't implant, sometimes we cannot explain. There are many other things that are not known in science. Like the biggest issue is about the implantation window. That is still being studied. So you can find that you put the embryos, but your implantation window has changed. Yeah, so that's not the medical legal issue. The biggest medical legal issues surround gamete donation. Because we can get donation from, we can have both sperm donation, egg donation, and we also have what we call third-party reproduction, that is that, plus surrogacy, okay, or gestational carrier. Some people want a baby, but they don't have a uterus that is capable of carrying. So that is the biggest medical legal hurdle, and especially legal hurdle in Kenya, because we don't have a law that allows the biological parent to be the one who has produced the gamete. If the baby is carried by someone else, usually in law, until adoption, that baby belongs to the gestational carrier who has nothing to do with the gametes. So that is the biggest hurdle that we have. And there are laws, the bill is still in Parliament, has not been concluded, that is trying to address this hurdle of surrogacy.
Kachar inendet kole nyolu kekochi toretet biik chetinye kaimutikab sikisiet.
Let's take fertility as any other medical condition. The same way people have diabetes, the same way people have hypertension, and they will stand up in a community and say, you know, I have diabetes. Fertility is something that should be discussed in the open so that people get support. These young couples are dying in stress and strain, financial strain, with no one to help them. So it is important that we take it as what it is. It is not something people bring upon themselves. It is not something that comes from aborting a lot. That's what people say. I do not believe that. A lot of the conditions, say something like endometriosis, there's nothing you can do to bring endometriosis upon yourself. So, and then the other message I have is that people should seek help early with the correct provider. So once you have been diagnosed to have infertility, it is important that your next step is you find out where you can go to a fertility. First, work with your gynecologist and they will refer you, or you'll also look for a fertility provider who her skills in correcting these things before you spend all your money and you spend all your time trying this and that.
Amwae kongoi amun kaiker tetutioni. Ongetuen wiki nenyone asikinai siwok akobo mieindoab bortang'ung.